Good afternoon, everyone. Good afternoon, everyone. Congratulations to the winner. Please do ask your queries. Please do ask your queries. I'm waiting. Hello, Jessica. Hello, Kavya. Good afternoon, Jessica. Good afternoon, everyone. Do ask your queries. Question 54. Okay. So, question number 54 is that there was a partial transverse vaginal septum, isn't it? So this was the question number 54. Partial transverse vaginal septum is present, and you have to diagnose that. mm, and the patient is coming with complaints of dysmenorrhea and chronic pelvic pain. So here, students, the answer will be endometriosis. Okay, that partial transverse vaginal septum will help in the backflow, okay, or retrograde flow. That what you studied in endometriosis, isn't it? There is a retrograde flow responsible for endometriosis. Okay, and moreover, the patient is also having the patient is also giving us the complaints of endometriosis, dysmenorrhea and chronic pelvic pain. Okay, so that's it. Is it okay, Jessica? Please reply. Good afternoon, Isaac. Is it okay to you, Jessica? Are you satisfied? 620, 61. Ramya, hello. Christian Raj, your question is 61, right? As per new 61 answer is up till 5 centimeter is the latent phase. Okay, whatever is the position of the station, whatever is the first stage is divided into two stages: latent phase and active phase. More than 5 centimeter is the active phase. Is it clear? Okay. Next query. I'm not getting any. Isaac, you are asking me that dysmenorrhea is present in seen in fibroid too. How can we differentiate? First of all, you should know that dysmenorrhea is very rarely present in fibroid. Okay, dysmenorrhea is very rarely present in fibroid. So this, Isaac, this is in respect to which question? 54, I think. Question number 54, you are saying this thing. In 54, there was no fibroid option. I think there is a lack. Isaac, please do mention with which question you are. uh, Endometriosis. Dysmenorrhea is very rarely present in fibroid. Already, this question has been asked in your FMG exam, that pain is only related to fibroid if there is its transformation to sarcoma, or there is a torsion of the fibroid. Otherwise it is not related. Okay, pain is very less unless and until it is obstructing the bladder or urinary pathway or the rectum. Okay. Okay, next is question number 22, Ayushi, right? um, See, this question 22 is vaginal cell adenocarcinoma. Can you write down for me which drug causes vaginal cell adenocarcinoma in the female fetus? Which drug causes? Okay, let's not think about this question. You tell me which drug causes vaginal cell adenocarcinoma. All of those who you are present, please write down in the chat box which drug causes vaginal cell adenocarcinoma if the mother has taken it during the intrauterine life. Yes, Ayushi, DES, diethylstilbestrol. It is nothing but estrogen. Okay, it is synthetic estrogen. Is it clear to you, Ayushi? Diethylstilbestrol is a type of estrogen. It is a synthetic estrogen. Okay, so all of you know this, but you didn't know that this is a type of estrogen. Okay, any other question, query? Any other query? 54, 61 and 22 has been taken. Good afternoon. Good afternoon, Sheila. Sixth, Sak, you want answer for the sixth question? Beta, in this question, you see they have asked that lochia is for how many days, continuous for how many days after delivery. They haven't asked about you that red lochia. Almost. Okay. Is it clear to you, Isaac? Lochia is for 15 days. Sixth question answer is they don't have asked you about lochia rubra. They have asked you about the lochia itself, and it is for 15 days. Yes, next question is 42. 42 question is how to differentiate pelvis as per shape. Okay, so you thought that it was android, right? So android is typically like heart. See, it goes like this. Okay, it goes like this. Okay, the interior part was not narrow. What you can do, or like these questions are very less expected, but what you can do in your book where you have that diagrams, you can draw the shapes. Isaac, is it clear to you? Doctor, is it clear to you? Is it clear to you? If you will draw that shape, it will become clear to you. When you, wherever you are in the exam, you just draw the inlet. On the inlet you draw the its shape with your pen or pencil, whatever, then you will able to differentiate. Okay. Next question is 59. Bishop score includes all except. Okay, so bishop score is to tell us the cervix. What is the status of the cervix? Is the cervix favorable or not? Okay, that is what is for the bishop score, right? uh, Rachna, you are asking when will be the next session for the quiz. Do you want it? Okay, I'm making it now itself. Okay, all those who haven't joined the quiz can join now. Rachna, it's there. You can join. So we were discussing about the bishop score, right? So bishop score tell us about the cervix status, that whether that cervix is sufficient enough to that the baby will come out or not. It includes five things. Of course, it will include cervix dilatation, cervix effacement. More is the cervix dilate, the more is the bishop score. More is the cervix effaced, more is the bishop score, right? And next is its cervix position and cervix consistency. Okay, dilatation, effacement, position. Position means is it anterior, posterior, or what, right? And the next is consistencies. It is soft, medium, or it's firm, right? And the last is fetus head station. Okay, molding is not included. Next question which you have asked is second, right? Second, 12 and 53. Okay. Second question is, so what is the treatment of eclampsia? Here they have asked you the treatment of eclampsia. Treatment of eclampsia is, first of all, you have to, this is second question, airway, put the airway so that patient does not aspirate its secretion. Next is meg sulfate, so that it is therapeutic and no other. Isaac, we will conduct the class. You will not have any problem then. Okay? We will take the class tomorrow or day after tomorrow, right? Uh, Airway, mag sulfate, and third thing is to terminate the pregnancy, right? Need not to wait for 48 hours for prematurity. Betamethasone 48 hours, you're not going to wait. Patient can expire, if eclampsia patient can expire if you're not terminating. It is an emergency. Okay. Next was 12. 12th question is Anti-D prophylaxis is given in all except. Beta, anti-D prophylaxis is given only if the sensitization has not occurred. Right? Anti-D prophylaxis is given only if sensitization of the mother. What do you mean by sensitization of the mother? If the mother body is not making. Okay, have you got? When we are giving intrauterine blood transfusion, it means that lot of antibodies are being produced by mother. If sensitization of mother is absent, then only it is advantageous to give the patient anti-D. If already the mother body is making so much of antibodies that hemolysis is occurring in the fetus, then no need to give anti-D. Is it okay? Ramya, have you got it? Question number 53 was Aftab, your query. Okay. 53 question number was interstitial implantation occurs in primates including human, which means blastocyst erodes through the endometrium in implants. Simple question was it. It was just asking when implantation occurs. After fertilization. Question number 53. After fertilization, it occurs on 7 to 9 days. Is it okay, Aftab? Okay. Next question is fourth. Aftab, tell me if you have got it and have understood. So, Isaac, your question was, in case of preeclampsia, impending signs of eclampsia are. See, whenever patient come to us in the emergency, a preeclampsia patient come to us in the emergency, then we ask these three symptoms. Okay? And if the why we ask the symptoms? We ask the symptom to see whether the patient can go into eclampsia or not. Okay, those three symptoms or signs are known as impending eclampsia signs. Okay, sign of impending eclampsia. What is the motto behind asking this signs of impending eclampsia? So that if the patient is having these signs of impending eclampsia, then we will shift the patient, admit the patient near the ventilator. Okay, we will admit the patient near the ventilator. So we will keep the patients near ventilator only if they are having a sign of impending eclampsia. It means eclampsia will occur. Then we have learned that we maintain the airway. How we maintain the airway? We maintain the airway by a intubation, or by putting the patient on ventilator, right? So these signs are headache. Headache is due to vasospasm in the cerebral vessels. Next is visual signs like blurring of vision, visual signs. Okay, and number 3 is epigastric pain. nausea and vomiting. Why they are so? Due to the stretching of the capsule of the liver. It is there. Uteroplacental insufficiency is not the sign. Have you got it? Any other query? Any other query? Any other query? Please clear it now itself. Isaac, you are asking about CTG chart. Okay, let me tell you. CTG. In CTG, there are three type of deceleration: early, late, and variable. Early deceleration, late deceleration, and variable deceleration. So first of all, we should know what is early deceleration. Okay, first of all, we should know what is deceleration. Deceleration is decrease in fetal heart rate 15 beats per minute. From average fetal heart rate is 120 to 160. So the decrease in the fetal heart rate is more than 15 beats per minute. Okay, so decrease in the fetal heart rate. For example, if it is 140, now the fetal heart rate has come to 120 or 125 this way. Okay, so and that is for more than 15 seconds. For more than 15 seconds, you are not going to take small deceleration in counting. Okay, okay, so now how we will label that this deceleration is early and this deceleration is late? Let's see that. Now the upper one graph is in the CTG is of fetal heart rate and the lower graph is of contraction. Isaac, now you will be telling me ki what is this deceleration. Okay, see, this is fetal heart rate and this fetal heart rate has dip and this dip is more than 15. Okay, this again fetal heart rate and again this is the dip and this is it. Now let us see what is happening to contraction in the lower graph. Okay, so now this is contraction. This is contraction. Now tell me what is the relation of Isaac contraction and fetal heart rate. This is one contraction, this is second contraction. Is it coming prior to contraction or is it coming after the contraction? Tell me, Isaac, any of you can tell who are watching? This deceleration is coming after the contraction or before the contraction? You need not to tell me contraction is deceleration is where. You have to tell me what is the relation of deceleration with contraction. Contraction से पहले आ रहा है deceleration या बाद में आ रहा है? Yes, it is prior. So this is early deceleration and which is seen in the case of head compression. Okay, which is seen in the yeah, it is before the contraction, so it is seen in the case of head compression. Okay, now let us draw the another. Now what is this? What is this? When it is coming, Isaac? After it. So this is late deceleration. Okay, so this is late deceleration. Okay, and late deceleration is due to the uteroplacental insufficiency, and in the late deceleration we have to do cesarean. How to solve new problems and listening explanation at you need not to listen to explanation. I will Isra, you have need not to listen to the explanation. We will solve your queries later. Okay, and moreover the video will be there. Okay, do you got it, Isra? Okay, so Isaac, this is late deceleration. Let us talk about now the another deceleration. Now this time, is there any relation? Is there any relation? Is there any relation? Isaac, is there any relation? So this is variable. Okay, what do you have to do in the exam? What you have to do in the exam, you just need to contraction, this contraction peak, you have to uh, draw it up to the fetal heart rate dip. Okay, like this, then you will very easily able to appreciate in the exam. Make a straight line, vertical line from the peak of the contraction and go up till the fetal heart rate curve, then it will be clear. Yes, Isra, there will be another discussion, don't worry. Any other query? Okay, go to that graph, Isaac, and draw vertical lines. Okay, then you will be able to see which type of deceleration are they. Any other query? Any other query? Everything is clear now? No queries left? Just after the your quiz session, there will be the discussion session. Okay, Isra? Any other query? Okay, should we close the session? Hopefully, we will have a class at 4 to 6 of the topic contraception, oncology, and urogynecology. 4 to 6, we will be having online class on contraception, oncology, and urogynecology. Okay. Okay, Isaac. So we are closing the session here. I hope everything is done.